Hi, thank you for joining us for this Facebook Live conversation with Katie Greeley and Becky Levin. I'm Jen Leininger from Lurie Children's. I'm the Associate Director for Community Programs and Initiatives. And we're here today to talk about modeling healthy drinking behaviors around the holiday season. Katie, can you tell us a little bit more about your role here at Lurie and how it kind of intersects with this topic?
Absolutely. So my name is Katie Grilli. I'm a licensed social worker and certified addictions counselor with the Potosac Family Division of Adolescent and Young Adult Medicine. I'm currently working with Dr. Ramondar to develop our new substance use and prevention program.
Here at Lurie Children's?
Yes.
Yeah, which is awesome.
And I'm Becky Levin. I am part of the Injury Prevention and Research Center at Lurie Children's. I'm the Executive Director of Strengthening Chicago's Youth, which is a citywide collaborative dedicated to violence prevention and positive youth development. So as part of that work, we convene a coalition called PACT, or Preventing Alcohol Abuse in Chicago Teens. One of the things that PACT is doing is conducting a citywide communications campaign called I Got This. The idea is to engage youth in 8th to 10th grade across Chicago and their parents and caregivers around preventing underage drinking. It's grounded in research that shows that the majority of young people in Chicago are not drinking, and the majority of their parents are talking to them about drinking. So we're trying to build from a position of strength and empower youth and parents to keep doing the right thing.
Great. So Katie, I guess I'd like to sort of talk to you first about why is it important to even be having this conversation? Why is it important around the holidays especially to talk about some of the pitfalls of underage drinking?
Absolutely. So, holiday breaks are great, right? But when teens have free time, they're also are more likely maybe to, engage in risk because they have less structure.
Sure.
With, celebrations occurring, often alcohol is a part of celebrations for adults, and teens see that behavior, and when teens look to what is, for what is healthy, what is normal behavior, they look towards adults to how adults are modeling that behavior.
Mm-hmm.
So when they see adults, drinking and celebrating around the holiday, and they kind of conflate the two and put them together,
right.
Celebration equals drinking. And I think that puts our teens at a higher risk of picking up a drink for the first time. Not to mention, they might see it as a rite of passage to have a glass of champagne on New Year's Eve, or something like that.
Yeah, no, that makes a lot of sense. And I do want to mention too, we're happy to have kind of questions from folks who are watching the Facebook Live. So please submit your questions throughout, and our awesome guests are happy to kind of help answer some of your questions around this topic as well. So in terms of like your clinical practice, then have you seen this like an uptake around like the holiday season with people binge drinking and stuff like that?
Absolutely.
Yeah.
So I think we see, from my experience in clinical intervention, providing substance use addiction treatment services, after the holidays, we often see a census increase in people receiving treatment for alcohol use disorder or other substance use disorders. And also we see that people are more likely to engage in binge drinking during these times.
Can you kind of tell me a little bit more, how would you quantify binge drinking? Because I think for some folks, they think about it as different things,
Yeah, and this surprises a lot of adults as well as adolescents. So binge drinking is defined as 5 or more drinks in one night for men and 4 or more drinks in one night for women.
Okay.
Yeah.
So is it like across a day, or is it really just at like one party in one setting?
I believe it's at, in a 24-hour period.
Okay.
Yeah.
So, how might adult overconsumption or binge drinking around the holiday season impact youth and their perceptions around drinking and alcohol consumption? Becky, do you have any?
Well, we know from research that the National Institute on Alcohol Abuse and Alcoholism conducted that a child who has a parent who binge drinks is more likely to binge drink themselves than a child who has parents who don't binge drink. So we may think that teens aren't paying attention to parents, but they actually do, and they copy that behavior.
Wow. Okay. Katie, do you have anything else that you might, how might youth seeing the adults in their space binge drink impact them, or?
Absolutely. I think it's really, especially around the holidays where, we're celebrating and we have gratitude for, the things that we have that are going well in our lives and the relationships and our health. I think that's a time where it's important to model healthy behaviors, right? How do we celebrate without alcohol present?
Sure.
How do we, make sure that we're enjoying family time, not under the influence of alcohol, right? It's really important while teens' brains are developing that they learn to have fun and engage in healthy relationships without the presence of alcohol or other drugs. So, the holidays, are a great time to model that behavior for teens. But if they see, when families get together, the only thing that kind of serves as a lubricant for that, experience to be bearable is alcohol, then that sends a toxic message. Yeah.
Okay. So I hear this a lot about like, well, it's the holidays and grandpa wants to, give her a sip of his beer, or, someone wants to have a taste of this wine, and, the Europeans do it. Is it okay to let your kid have, a glass of wine or even just like a sip of alcohol during the holiday season?
Well, so the research shows that a young person who's had a sip of alcohol by 6th grade, that by the time they get to 9th grade, they're at significantly higher risk of drinking a full drink,
Oh, wow.
getting drunk, and drinking heavily.
Okay.
So really giving that sip of alcohol undermines the message that we're trying to send about not wanting young people to engage in underage drinking.
Yeah, I think it's a great point. I mean, that's what the research and data obviously shows. But, if you do, if parents have done that before, have given their kid a sip of alcohol, to make the kid feel like an adult, right? Because that's what teenagers often just want to feel like adults, right? But, drinking does not necessarily equal adult behavior. So does that give them the permission for them to engage in that behavior when there are no adults around? Are you having a follow-up conversation with, like, that was a one-time thing, that's something that we're not going to do again? Because I think parents often, don't have all the information, and they have done that before, and it's because we don't always have all the right information and the data right there to continue providing that guidance for our kids.
Right, so like if you're a parent who's watching this and is thinking like, oh my gosh, well last year I did give my kid a glass of wine, it's certainly not too late to have that conversation, sort of share the knowledge that they've gained, and here's like me also being a flawed adult person.
Yeah, right. I think what we do know is that, the longer we, in drug prevention education, we don't say don't do drugs, we don't say don't drink, we say we provide evidence and we provide facts for teens these days. And what we do know is that the number one risk factor for adolescents to develop a substance use disorder or alcohol use disorder is age of first use. So the younger we provide that sip or that beer or that drink, we're putting that child at a higher risk of developing a substance use disorder later on in their life. And so we want to delay that as long as possible.
Yeah. Well, so I guess then when you're sort of talking about this, it kind of leads into my next question, which is about like brain development. So you said you want to really delay that as long as possible. Can you talk a little more specifically about that brain development piece and why that might be?
Yeah, absolutely. So I think, we're as, I'm not a scientist, right? but scientists and medical professionals and, again, what the peer-reviewed research shows is we're just beginning to understand how the brain works and when it is fully developed and all of that. Right now, what we are being told is that the brain isn't fully developed until age 25, right? And so the last thing to develop on an adolescent brain is the prefrontal cortex, the part of the brain that is responsible for risk and reward, judgment, our inhibitions. And so, I've been trained to think of the brain, specifically the adolescent brain, this way, right? You have the midbrain, which is the limbic system, which is responsible for survival. It's telling us go, 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 right? And we got to ask ourselves as parents or as adults who guide adolescents, what does survival look like for an adolescent, right? And often that's fitting in. And that's where, the idea of drinking and fitting in, often, that misinformation leads an adolescent down the path of choosing to pick up a drink. But if they believe that's fitting in, right, and their limbic system is telling them you have to fit in order to fit in, you got to drink, right, and their prefrontal cortex is, isn't fully developed and can't weigh the risk and reward of that, they're at a higher risk of picking up a drink. So what do I compare the adolescent brain to? Well, you got a limbic system, the midbrain, that drives impulses, that is a Ferrari engine, and then you have the prefrontal cortex, which isn't fully developed, which is bicycle brakes. Right?
Oh, no.
So what does that mean? We have adolescents, the reason why adolescents, engage in risky behavior is because their prefrontal cortex aren't fully developed yet.
Okay.
And so as adults, especially when it comes to this topic, right, with putting, making sure their brains develop in a healthy way without the presence of alcohol or other drugs, it's very important that, we are their prefrontal cortex until theirs fully develops.
Okay.
Yeah.
So kind of reinforcing the information, and maybe you have to tell it to them multiple times.
Yes.
Like, I know we talked about this, I just want to make sure you know that we're on the same page here about drinking. And
Yes.
kind of continue to have that conversation. Does that kind of also feeds into like part of the Agathis campaign too? Wouldn't you say, like, around the making sure to have those conversations with?
Absolutely. So as I said a couple minutes ago, we know that the majority of Chicago youth report that their parents are talking to them about alcohol and about setting rules about drinking. But we also know that that drops off over time.
Okay.
So the 8th graders are more likely to say that their parents talk to them than 12th graders are. And so what we really need is more consistency in delivering that message. We want parents to keep that up throughout the teen years. Whether a young person is 14 or 16 or 18 or 20, those messages about not drinking underage are critically important.
So it's not, okay, great, I sat my 8th grader down, we talked about alcohol, got it all out, we're on the same page, I'm done.
Yeah. It's not one 60-minute drug talk, check, we're done. It's 61-minute conversations, right? Any way we can get their prefrontal cortex to critically think about this topic, and every year we get them to delay use and we're promoting the healthy development of that brain, and that's so crucial to their health.
Okay, so it's like every year that they haven't consumed alcohol is a total win for their brains developing healthfully.
Yeah, absolutely.
Okay. So we've talked a little bit about, like, okay, binge drinking, we shouldn't be doing that around the holidays, especially around young people. So how would you kind of quantify, or can you talk about, like, what would healthy model setting look like, or healthy modeling look like?
Yeah. I think, as adults with fully developed brain, it is your right to have a glass of wine, right? It's your right to celebrate the holidays with your family, and you are entitled and able to do that, right? And you should do that. But I think it's important to, make sure when your child sees you drinking or having a drink that they know that there's a difference between an adult brain and an adolescent brain, right? Bringing the conversation back to health, right? There's a difference between, an adult having a glass of wine and a kid having, a drink. So making that clear. There's also plenty of adults who choose not to drink for many reasons, right? It could be because they are in recovery and maybe they used to have a substance use, disorder, and they're happily in recovery and healthy now. Maybe they just don't like how it makes them feel the night of or the morning after. Maybe they'd rather be there and be present in the moment and clear-minded. So kind of celebrating those adults who choose not to drink.
Okay.
So kids can see that, plenty of adults choose not to engage in that behavior, and they don't have to, and that's not what being an adult means. Yeah.
Right. Because I think a lot of youth, I've heard, like, celebration for an adult does include alcohol, but that really isn't always the case.
Yeah. And that's another, a great point. Every time, not just the holidays, but every time you have an adult gathering in your home, right? A dinner party, does there have to be wine there? No, right? But is a child seeing that every time adults gather, there is some kind of spirits in the room? Because it is possible for, us to show them that, that's not necessary to have a good time at, socializing with adult peers.
Okay.
Yeah.
And we did just have a question come in, which I think brings up a really good point. If you're thinking about having these 61-minute conversations, what does that look like? How do you navigate that? Is it simply just saying like drinking is bad, or is it, can you kind of elaborate on good jumping off points to start that conversation?
Yeah. So I think we want to be very careful and intentional with our language, right? So drinking is bad, that can do more harm than good. And let me explain why. When it comes to substance use, right, and getting, addiction and getting help or engaging in this conversation, for so many years this topic has been so stigmatized, right? And so as a health institution, right, Lurie Children's Hospital, we are looking at addiction and alcohol use as a health issue, right? So it's not drinking is bad, it's drinking is unhealthy, right? And drinking is especially unhealthy for an individual with an undeveloped brain, right? So not saying, this is bad, don't do this, rather like, I love you, I care about you, and as your parent or as an adult in your life, I want you to, be healthy. And the best thing for you to do when it comes to alcohol is to delay the use of alcohol for as long as you can, because it is unhealthy for your developing brain. If you do drink, there will be consequences, and this is what that consequence will be, right? If a kid can point to a consequence that their parent has laid out for them, they're going to think twice about making that choice. And then if the kid does break that rule, the consequence is executed, whatever that might look like. And then the follow-up conversation, which is so important, right? Which is, all right, and if you drink again, there will also be this consequence. So that consistency across the board is very important, right? And again, that's a repetitive conversation.
If you do catch your kid drinking, is it ever worth asking, why might they have consumed that alcohol?
Absolutely, right? And, we know stress can be a factor. We know wanting to try to, fitting in could be a factor. And that's not a lost cause conversation right there. That's a very important conversation, right? Because if your kid says, hey, I'm really stressed and, this helps me blow off some steam, well, that's a red flag because, that adolescent's brain needs to develop knowing how to handle stress. And if they're relying on alcohol, they're not developing that skill.
Sure.
So now we got to teach them, healthy ways to manage stress. Or it's because they think they're not fitting in, right? We can take them, as a parent, right, or as an adult in their life. We can now model media literacy with them, right? We can take them to the Illinois Youth Risk Behavior Survey, or we can take them to Monitoring the Future and look up with them actually how many kids engage in use of alcohol. And, the data shows that the majority of kids make healthy choices when it comes to alcohol, and let them know that they're fitting in if they choose not to drink. So, yeah.
We have a lot of tips on how parents can talk to their teens on our campaign website, which is IGotThisChicago.org. We also think it's really important for parents to be supporting each other in this. Just like the majority of teens in Chicago haven't had a drink, we want parents to know that if they're setting down rules, they're part of the majority of parents and kind of grow that groundswell of support. So tweet at us using the hashtag I got this Chicago to share those ideas about what did your conversation with your teen look like. Maybe the next parent can use that exact same tip and you can share ideas with each other.
Kind of try to build that parent community.
Exactly. We aren't in this alone, right? We call it I got this, but really it's we got this collectively.
Totally, I think that makes a lot of sense. So another question that came up was, I've heard about these parties where parents will allow kids to drink. They'll take away the keys to make sure there's no drunk driving. Is that something I should be talking to other parents about? Is that what are sort of the consequences of parties like that?
And this is something I come up against a lot, right? And there's two parts to this, right? The idea is that the kids are going to drink anyways, so I might as well provide them a safe place to do that. And again, the data shows that, no, the majority of kids are choosing not to drink, right? So when parents and adults have that misinformation, right, and they allow that behavior to go on in their home, sometimes it's them actually putting the drink in that kid's hand, right? And that's a risk factor for that kid. And the idea is I'll keep them safe. I'd rather be watching them and know where they are and know that they're safe in my home. And I'll take the keys. And what we say is, that's great. You took the keys from the kids. Those cars are going to stay very safe. There's a lot of other things that, that happen when underage people drink. That is risky behavior, right? That can be, first off, again, we know the developing brain, right? We're interacting, the alcohol is interacting with the underdeveloped brain. We know that, the adolescents are at higher risk of getting into an uncomfortable sexual situation. We know that adolescents are more likely to engage in binge drinking and experience alcohol poisoning. So those are the things that people don't think about. They think about the tragic, drinking and driving, that still occur when parents provide that space for kids. Teens should be allowed to be teens, and they should be allowed to socialize, though. And often those get-togethers are going to happen at parents' homes, right? So if your child is going to another parent's home, know your child's friend, right? But also know your child's friend's parents, right? What are their values? What are their rules? And if you don't know their parent, right, give that parent a call. And let them know, it's my expectation that my kids remains abstinent from using alcohol. Is there going to be alcohol at this party, right? And then it's about setting that boundary with the child, right? And they might not like you for it, but you're the parent and you get to make the call if they're allowed to go to that party or not.
Right.
Yeah.
You're helping be that proof from
Exactly.
And
yeah.
one of the things we're trying to do with I Got This campaign is really establish that social norm in Chicago, that parents will be asking the parents of their kids' friends about this, the same way that before a play date a parent would ask about food allergies or use of car seats. This is another health issue that parents should be asking other parents about.
Absolutely.
Yeah. So if there are parents who are looking for additional resources, are there places you can point to or things that they can, if they feel like they need additional support in the Chicago area or even nationally?
So in Chicago, I'll recommend our website, igotThisChicago.org. We have on there tips for parents about talking to teens, tips for parents about talking to other parents, tips for teens about talking to their friends about engaging in healthier behaviors. We have on there some of the statistics that parents can use in bolstering their conversations with their kids about this. So again, that's igotThisChicago.org.
Okay, that's great. Is that something are youth talking to each other about this a lot, and does that have a big impact? Do we know?
From my experience working with youth, they've talked to adults about this topic, but they really haven't gotten each other's perspectives on what's actually going on in their community when it comes to alcohol use. And often when we've facilitated those conversations, they're surprised to hear that their peers are making the choices not to engage in use, right? Because in today's age, with social media, it's a silent majority of kids making healthy choices and a loud minority of kids making unhealthy choices, right? And the kids engaging in healthy behavior, right, like studying, or going to soccer practice, getting a full 8 hours of sleep at night, right, and getting A's, that's not, that's the norm, right? That's not, quite doesn't bring in as much attention as that kid or that story Monday morning about the party that might have gotten busted or the kid that got in trouble on campus, right? And so when kids hear a collection of those stories, they perceive that more kids are engaging in it than they actually are. So when you facilitate a conversation with a group of kids, and allow them to really share their own experience and their perspectives on this topic, they're surprised to hear that most of them are making healthy choices and that drinking isn't cool. They don't perceive that drinking is cool. But often they don't, without being facilitated, they don't get the chance to have that conversation. Yeah.
And so that's another thing with the hashtag #IGotThisChicago. We would encourage young people to share their positive stories. Share a story about that A that you got on a test because you were studying. Share a story about going with your friends to ice skate and drink hot chocolate. There are so many fun, positive things that young people can do without drinking.
Absolutely.
And it sounds like maybe adults should also try to share those things that we do too. That
Absolutely.
around drinking and stuff like that. I think we have one more question too that is, so I'm worried that my son is drinking. I
Mhm.
caught my kid drinking, and I'm worried that it's related to stress and other sort of mental health issues. What can I do to help? How can I help?
Yeah. So, if you are concerned about your child or someone else's child, and, potentially because they are using alcohol or other substances, right? It's difficult to tell at first, right? Because often the symptoms of a substance use disorder look like normal teenage behavior, right? Not enough sleep, moody, change of friends, things like that. But you know your kid, right? And if you have that gut feeling that something's wrong, I always tell parents there's absolutely no risk in getting an assessment. And depending on your location, wherever you're at, you can go to SAMHSA's website, so that's SAMHSA, and type in your zip code, and that SAMHSA will provide you with, substance use treatment facilities in the area that can do an assessment for your child.
They also, I think, have like a 1-800 number you can call too.
Yeah.
So that's SAMHSA in case you missed it.
Yes.
Yeah, I think that's a really helpful resource. Thank you for sharing that.
We also know that that's a really common reason why young people in Chicago would be drinking. We partnered with a youth leadership organization called Voice, or Voices of Youth in Chicago Education, and they conducted research with Chicago teens to ask them why teens in Chicago might drink. And they really found overwhelmingly that young people in Chicago who are drinking are doing it because of stress, because of exposure to violence and trauma, because of a lot of complexity in young people's lives. So I think the other thing I would add, if a parent is facing this with your own child, you aren't alone.
And just so for Voice, that's VOYCE, if you wanted to really amazing youth-centered work. So I have just one wrap-up question, which is, what do you want parents to remember? From this conversation around setting healthy behaviors, modeling healthy behaviors, because this is a pretty intense thing, I think, for a lot of folks to navigate, and it's hard to sort of know where to start.
Yeah. I think, teens look to their parents to interpret the ways that they should act and move through this world. And, you are, even though some days it might not seem like it, they're listening to you. So any way you can model healthy behavior around this topic is a win, right? And truly, what I believe is the most important takeaway is we want to delay use of alcohol or other drugs for as long as possible and allow that teen brain to develop into the beautiful brain it's supposed to be. Yeah.
And I do think that's helpful to remember. I hear you say like alcohol and other drugs. I think sometimes folks think of it's like legal, it's normalized. So I think that's also helpful framing for parents to remember too.
Absolutely.
Any tips or any last thoughts?
Yeah, so just parting thought, we know that the majority of young people in Chicago are making good, healthy choices to abstain from alcohol. We know that the majority of parents are talking to their kids about setting down rules around alcohol. So I think my parting thought is keep it up and let us know how you're doing it through I Got This Chicago.
Yeah, well, thank you very much for joining us.